So today we'll move on to the new session. Okay. I hope everyone have joined. Shall I start the class? I'll start the class. I'll share my screen with you people. Okay. Is the screen visible to you? Is the screen visible to you? Can someone respond? Can someone respond if the screen is visible or not? I request someone to please respond. Is the screen visible?
Yes, the screen is visible to me. Yes, it is.
Yes or no? Screen is visible? You can
Yes,
see
it is. My network is having some problems. I'm watching. I'm still waiting to see the screen.
Please mute. So, I request please mute yourself. I request everyone to please mute yourself. Please mute yourself. I request the person to mute yourself. And if there is any doubt in between, you can unmute and you can ask me the questions also. Okay. So today in this session, we are going to learn about the medical sociology and anthropology for the nursing students. Okay. So that is what we are going to learn in today's class. So have you ever heard of this medical sociology term or medical anthropology? In the coming slides, we will be learning what does this term denotes and why it is important in the nursing day-to-day life. Okay. So very first thing, what is the definition of sociology? As you see, sociology is like a scientific study of the society, human behavior, social relationship of people, and the different institutions. So this is what the term sociology denotes. So it's a scientific study of society, human behavior in the society, how is the social relationship between the people and between the institutions. And this sociology will examine how an individual or a group will interact within a structured society. So when you're living in a society, there are different peoples from different backgrounds. So how those people will interact with themselves in a structured society. That is what the sociology explains. And the sociology will focus on what are the different patterns, what are the different cultures, what are the different norms or different standards, and the different social dynamics. Social dynamics means how the people will interact among themselves and how that will shape the behavior, social behavior. So this is what your sociology will look forward. So sociology is nothing but the study of society, about the human's behavior, social relationships of among people and between the different institutions. And this will see, sociology will see how an individual or a group of people will interact within themselves in a when they are living in a society. Here, now we'll see how this medical sociology has been evolved. Like how was the history about medical sociology? So medical sociology was emerged in the early 20th century only. And this was influenced by the development of social medicine and the public health concerns. And later it became a distinct discipline in the year 1950s with the contribution of a sociologist like Talcott Faison, and later it was recognized as an essential field in understanding the healthcare and patient behavior. So starting, the sociology has been emerged from the 1950s only. This has got its development when they started with the social medicines and when they started with the public health concerns. And later, a sociologist named Talcott Faison, he has given some distinct disciplines and later it formed a proper medical sociology. And now it has become an essential field in the healthcare as well as to understand the patient behavior, medical sociology is an important factor. Again, we'll see the emergence of medical sociology. So as I told you, it is evolved from the general sociology with a focus on health, illness, and healthcare system. So your medical sociology will focus mainly in the healthcare system, what are the different illness people are coming across, and how does the healthcare system works on that. So this is what your medical sociology mainly focuses on. Once again, your medical sociology focus on how the health of a person is maintained, what all illness a person can get, and how does the healthcare system works on it. As I told you, in the 1950s only, they saw there is an increased interest in studying the how a social factors influence the health. So that is how the medical sociology has evolved. Like people got an interest in studying regarding various social factors, how that will influence people's health, and that's how the medical sociology has been evolved. Later, there are different organizations like World Health Organization, UNICEF, like that different organizations and different institutions also encouraged all these social perspectives in the healthcare system. So that is how the sociology, medical sociology has become in the day-to-day life, medical sociology has become a integral part of the public health policies and in the nursing education. So when this medical sociology got recognition from the World Health Organization and other institutions, later the medical sociology has become one of the important part in the public health policies and in the nurses education in the day-to-day life. So your medical sociology will mainly focus on the human health, human illness, and how the healthcare system will work on it. So this is what your general sociology will look forward. Then your medical sociology was derived from the classical sociological theories, mainly which address on the health and illness. As I told you, your medical sociology addresses more mainly on the people's health and the various illness they come across. After the Industrial Revolution and urbanization, there was an increased interest in the public health and in the medical practices. That's how your medical sociology has became more popular. Later, the WHO, that is the World Health Organization, and various other governments has emphasized the social determinants of the health. And then many researches has been done on this and medical institutions. Later, this doctor-patient relationship, various healthcare accesses, again contributed to the expansion of your medical sociology. Like as I told you, medical sociology looks forward the healthcare system, how it works and everything. So there were many medical institutions. Then in a medical institution, obviously there will be a doctor-patient relationship, right? Then there will be various medical accesses, which has everything will contribute to the expansion of your medical sociology. And presently, medical sociology plays a vital role, that means an important role in the healthcare studies. So that is how your medical sociology has become so much popular in the healthcare studies. That is why it is important in your nursing field also. Clear? So what does a medical sociology looks on? So medical sociology is a scientific study of the society, about the human's behavior in the society, what are the social relationship of the people and between the institution. And they focus on how an individual or a group of people interact among themselves when they are in a society. And sociology mainly focuses on the, in what they mainly focus? They mainly focus on the health, illness, and the healthcare. How does the healthcare system works? Is this much clear for you all? Is this much clear? Is that clear?
Yes, mom, it's clear.
Yes, yes.
Okay, okay, thank you. Now we'll continue with the what are the main key concepts in this medical sociology. Okay, one by one we'll see. So as I told you, medical sociology focuses on the health and illness. The very first concept of medical sociology is the concern is the health and the illness. Like which are the different various social determinants of the health and how the cultural perceptions of the illness are there. So this is the first key concept. it's the health and the illness of the people. This is the very first concept of your medical sociology. That is people's health and various perception of the illness. Second is the healthcare system. That is how an healthcare system is structured, how the healthcare system will function, and how this healthcare system is being organized. This is the second key concept of the sociology. That is how an healthcare system is being structured, how an healthcare system will function properly, and how the healthcare system is organized in a proper manner. So your medical sociology will examine how the healthcare system is being structured, in what way it is being formed, and how an healthcare system as a whole will function properly so that the people will get the medical treatment properly, and how much efficiency of the healthcare organization is available globally. So this is what your medical sociology will look after. And this also will include the analysis of the various healthcare policies, then accessibility, like in the rural areas also, if there is medical accessibility and there is a quality of care is also been provided, all these things will be looked after by the medical sociology. So medical sociology will look after what are the different health determinants as well as what are the different illness. Then it will look after how an healthcare system will function, like how it is being properly organized, how they are functioning, then how the healthcare policies, what are policies they have, then how much accessible your healthcare system is in the rural as well as in the urban areas, and how much quality of care this healthcare system provides for the people in a society. Third one is the development of a doctor-patient relationship. As I told you, when a patient approaches any hospital, obviously the patient has to communicate with the doctor. So there should be a trust build-up should happen. There should be a proper communication should be happening between the healthcare provider as well as the patient. And there should be a power dynamic influence for the medical interactions also. When a healthcare provider, like when the nurses communicate properly with the patient, then only they can build up a trust. Then only your patient will open up and they will tell each and everything to you. So there should be a proper communication. Like there should not be any sort of barrier. Language is one of the major tools, so there should not be any sort of barrier. There should be a proper understanding and communication should be there, and you should have a influence. Then only your medical interactions can happen with the patient. Then your medical sociology also will examine what is the role of empathy. You should always show empathy to your patients. Then what are the medical authorities, and you should always respect your patient autonomy. Patient autonomy means what is your patient's interest. If the patient wants to undergo the treatment, then you should respect. If the patient doesn't want to undergo the treatment, that also should be respected by your medical profession. So that is how you build up a doctor-patient relationship. So this is the third key concept of the medical sociology, building up a proper doctor-patient relationship by building a proper trust, by having a proper communication, and by showing the empathy and respecting the patient's autonomy. Fourth main concept and key concept is the health inequalities. Like being a nurse, the impact of socioeconomic status, race, gender on the health, you should not show any inequalities when you are treating a patient. Understood? Like when you are getting a patient, you should not see what is their economic status, what is their race, whether it is a male or female. You should not see anything. You should give them equal treatment should be provided for each and every patient. So health inequalities also being checked by the medical sociology. So you should always treat everyone in an equal and in a respected manner. Understood? Then fifth one is the medicalization. Medicalization in the sense like how social issues will become a medical problems. Like the process where a non-medical issue becomes a defined and treated as a medical problem. Examples include mental health disorders, childbirth, aging. That is, see the mental health issues, like people take a lot of stress and they lose their mental stability. So it's a non-medical issue, which later they come for treatment and becomes a proper medical problem. Same like childbirth. It's a natural process. and later they seek the medical treatment. So it becomes a medical problem. Again, aging, that is also a natural process. Again, in the aging, people will come across with the various diseases, infections. So again, that is a non-medical issue coming to the hospital and becomes a medical problem. So this also is a third major key concept in the, it's also a social issue which becomes a medical problem. So this is the fifth main key concept of a sociology, like how a non-medical or natural issues will end up as a medical problem. For example, mental health disorder, like mental stability will be lost by a patient, like by a people due to some stress and everything, and later they seek for medical treatment. Then childbirth, aging, which is a natural process, again the people seek for medical treatment. So that is how a normal social issue become a medical problems. Then the sixth main key concept is the social epidemiology. Social epidemiology means like the various patterns of diseases in a population. If you see, there are various types of diseases are spreading in a population. So your medical sociology will analyze like what are the different factors. Usually you can see poverty as one of the factors. Like when there is a poor person is living, they won't approach medical facilities because of the cost. So they have higher chance of infections because of environmental issues, which is another problem for diseases to spread. Then lifestyle, like various food or not having a healthy lifestyle also cause health conditions. So this is how a disease in a population has varies. So this is the sixth main key concept in the medical sociology. Like medical sociology will analyze how are the different factors affects the people in a society, like poverty, like how a poor people will not have that much access to the hospital side, environmental factors which can cause diseases and various other problems, then lifestyle of a person, like if they don't have a proper healthy lifestyle, again they will come across various health conditions and they have to approach the hospitals. So these are the various key concepts in a medical sociology. So once again, one is the main key concept in medical sociology is the health and illness of a person. Then how does a healthcare system being structured and function, and how it has been formed, and how much accessible the healthcare system is, and how much quality care they provide for the people. Then how a healthcare system develops a proper doctor-patient relationship, and how health inequalities is being treated, like by giving a proper treatment, equal treatment for everyone. Then how medicalization, like a non-medical issue becomes a part of medical issues, and then what are the different patterns of diseases which can come across the population. So these are the various key concepts in a medical sociology. Is this clear? Various key concepts are clear. Various key concepts are clear.
Sorry, Mom.
Clear? It's clear?
Yes, it's clear.
Okay. So now we'll see where and all there is a scope for this medical sociology. Okay. Where and all your medical sociology has a role. That is what scope of medical sociology. Where and all medical sociology has a role in the society. The first one, social determinants of the health. There, your medical sociology has got a role. That is, your medical sociology will examine what are the different impact of the various social, economic, and environmental factors on an individual as well as in a community. As I told you, there are different social status. If you see a community has got different social status, like there are rich people, there are middle class people, there are poor people, there are almost like there are different categories of people. So how that will affect a community's health? Like poor people will have very less access to the healthcare system, whereas a very rich people will have more access to the community health. Then economic, then environmental factors, like those who are living in the slum region, they have more kind of diseases, whereas in a healthy lifestyle people are maintaining, they will have less health issues. So, like, what are the different various factors which can affect a individual as well as a community's health. So that is the first determinant or the scope of your medical sociology. It will examine, your medical sociology will examine what are the different factors which can affect a individual or a community's overall health. The factors can be either the social or economic status of a person, various environmental factors, or anything that can affect a individual's or a whole community's health. This is the first place where your medical sociology has a role. Second thing about the patient behavior and the complaint. For example, your medical sociology will investigate how the social norms means different social standards and the cultural beliefs will influence the health-seeking behavior and treatment adherence. That is, if you see people, there are different culture peoples are there. Like if you categorize people, there are Hindus, Muslims, Christians, Buddhism people. Like that, there are different cultural beliefs are there for everyone. And there are some cultures they believe that no need of treatment is required. Just they need to pray to God, they get the deliverance. Like that kind of people are also there. So there are, and where are other people, they directly seek for the medical treatment. So that is how the patients will behave here. So they will, so the medical sociology will investigate what are the different social standards and what are the different cultural beliefs which can influence the health seeking behavior. Some people will seek the health and some people will not come for the hospital treatment. They think that if they pray, they will get the proper deliverance. So that how that will affect the overall treatment adherence. So this is the second place where your medical sociology has a scope. Third one, in healthcare policies and reforms. Like your medical sociology will analyze what are the different development and what are the impact of our healthcare policies. If you see, various hospitals have its own policies, its own insurance schemes and all. And that will be checked after by your looked after by your medical sociology. So your medical sociology will look what are the healthcare policies a hospital will provide, what are the different insurance schemes they provide, and reform on public health. Reform means if they want to make any changes, that is reform, that is to make any changes that also can be done for the public health. So this is the third place where the medical sociology has a scope. That is in the healthcare policies to look after what are the different healthcare policies, what are the different insurance schemes, and to reform and to make any changes. Your medical sociology has a role in the same. Next is health disparities. Health disparities means studies differences in the healthcare accesses, treatment, and outcome based on socioeconomic status, like race, gender, and geography. As I told you, there can be many health disparities can occur, like based on the people's healthcare access. Like those who are in urban area has more access to the healthcare system, whereas in the rural area, healthcare system is very less. So that accessibility. Then mode of treatment. Like in the urban area, there are various equipments available for all sort of treatment. Then outcome-based socioeconomic status, like poor people, based on gender, based on where they live, there can be various health disparities can occur. Like inequality in the treatment can occur. So there also your medical sociology will look after that everyone will get a equal treatment. So this also is a place where your medical sociology has a role. So in the health disparities also, your medical sociology will look after whether everyone in every place gets a equal treatment within the society. Clear? Next is your mental health and society. Your medical sociology also will explore what are the different sociological aspects of a mental health. Is there any stigma attached to that? And if everyone is getting the equal access to the mental health care. That is, for example, there are many stigmas in a society. Stigma in the sense, if a person is being turned positive for HIV, then there is a social stigma that people should not touch them, untouchability, or if you sit with them, then you will also get that AIDS. That kind of stigma is attached. So all these things is looked after by the medical sociology. And it also makes sure that everyone get an access to the healthcare system. Then workplace dynamics in healthcare. That is, your medical sociology will also look after when the nurses and when the people are working in a working area also, they look after how, what is their role, what is their relationship, what are the different challenges, working place, what are the different challenges they face in a healthcare professionals in the medical institution. So this also been looked after by the medical sociology. For the nurses, for the other healthcare providers, what are the different challenges they face in their healthcare professionals when they are in the medical institution. So this is also looked after by your medical sociology. Then technology and healthcare, like various investigations, the impact of medical advancements. Now there are a lot of medical advancements occurring. So that and all has to be looked after by the medical sociology. Then telemedicine and digital health solutions on the society. Like, nowadays people don't have to come to the hospital. They can directly call the doctor and they get the solutions. So that is what the digital health solutions. Then telemedicine. You can directly book your medicines and they'll give you home delivery. So these are recent advancements, how that affect the people in a society. So technology and healthcare is also looked after by your medical sociology. Understood? Then end of the life care and ethics. That is, it examines the ethical issues, palliative care, and the role of sociological perspectives in the death and die. That is, there are people who are very sick and not able to come to the hospital. For them, there will be a palliative care. That is, the medical professionals will come to their home. They'll come to their home and they provide the medical facilities at home. Even in the death also, everything will be taken care by the medical professions. So that is what end of the life care and ethics. That is, people who are that much sick, who are not able to come to the hospitals, the medical professionals will visit their home, and in the home only they'll provide all the medical facilities. Even if they die also, that also will be taken care by the medical professions. So these are the various regions where your medical sociology has got its role. Clear? So once again, medical sociology has a role in determining what are the different social determinants of a health, then how a patient's behavior will affect the healthcare system, then what are the different healthcare policies which are given by the medical sector, and do they need to change or not? Then what are the different health disparities can occur in the medical sector and how it can be managed, then whether the people are getting equal care and access to the health and society, and what are the different workplace dynamics, and that also been looked after by your medical sociology. Then what are the recent technologies and advancements in the healthcare, that is medical advancements, telemedicine through phone calls or digital health solution. You can contact your doctors through the digital way, like how that will affect the society. And the end of the life care, like palliative care given to the very sick people, as the medical professions will be coming to their home and visit them and give them treatment and everything. So this is where your medical sociology has a role. Is this clear? Miss Mitch is clear?
Yes, madam, yes.
Okay, now we'll see what are the importance of this medical sociology in a nursing field. Like why this sociology is required in your nursing field. So one thing for your people to provide a holistic patient care. For a nurse to treat a patient, they should provide a holistic patient care. So you should first understand what is the social factors, what is causing, what is affecting their health. So being a nurse, you should understand the social factors which are affecting the person's health. Then only you can give a proper holistic patient care. Second thing, cultural competence. Cultural competence means every nurse has to adapt the care to diverse population. Like there are people who are living in the slum regions, there are people who are in poverty. So everywhere you should give a proper care. So adapting nurse care to diverse population. Even they are rich, poor, or whatever, you have to give a proper care to every population. Then health education promotion. So you are the one who is treating the patient. So you should encourage your patient to have a healthy behavior, healthy lifestyle when they are living in a community. Then only you can give them a proper health education and you can teach them what are the requirements, why it is important. So to encourage your patients to have a healthy behaviors in the community, then improving the communication. As I told you, for the nurses and for the patient, the important tool is the communication. So you should enhance the nurse-patient relationship. That is, you should build up a trust between you and your patient, so that you can have a proper communication. You can build a trust, and you can respect your patient. So in such a way, you can improve the communication among the nurse and the patient. Then addressing the health inequalities. Like you should advocate for vulnerable population also. Like being a healthcare profession, you should not show any inequalities when you're treating a patient. So you should give everyone a equal care. No matter whether the patient is poor, rich or whatever, you should give a equal care for everyone. Then different policy making and leadership. Like nurses should contribute to the healthcare reforms. Like you should look after what are the healthcare policies and you should make some changes and you should make policies improvement also so that more patients can access the healthcare system. So thus, your medical sociology will provide a valuable insight into the healthcare and nursing practices and thus helps the nurses to understand your patient beyond the medical condition. So when you build up a trust among you and the patient, you can have a communication and then you can have a bond beyond the medical. Like you will not actually, will not only treat the patient's disease, you actually treat your patient's mental health also. Thus, your medical sociology will play a critical role in developing a patient-centered care, and thus you can improve the overall healthcare system. So when you behave properly with your patient, when you respect your patient, they will also give respect. So that's how a patient-centered care can be given by the healthcare system. Thus, you can overall improve the healthcare system. Understood medical sociology. Why medical sociology is important in the nursing? One is to provide a proper holistic patient care. You should understand your patient. Second thing, you should adapt every cultural competence and you should make them understand and then you should respect them. Then for your health education, you should advocate your patients or you should teach them to have a healthy behaviors or healthy lifestyle in the communities. Then you should have a proper communication with your patient so that you can build a trust among you and the patient. Then you should not show any inequalities when you're treating a patient. You should treat everyone equally. Then you should look after what are the different policies and you should change or you should improve your hospital policies. Thus, you can treat your patient and that's how you can improve the overall healthcare system. Understand medical sociology, why it is important for your nursing profession. Clear medical sociology? Can someone respond if you are clear? Is it clear?
Can you come again, Mom?
Sorry?
I can't get you well. I have some network problems here. Can you say come again? Let me hear you.
Can you understand what I'm teaching?
Yeah, I'm understanding.
Okay, so we'll move on to the next topic, medical anthropology. You can see the slides, no?
If you come up,
You can see the slides? You can see the PPT?
yeah, I can see it.
Okay, so now we are moving on to the next topic, that is medical anthropology. So till now we have learned about what is medical sociology. Like we have seen how the people will interact among themselves when they are living in a community. That is what we have discussed so far and why that is important in a nursing field. That's what we learned. Now we are moving on to what is medical anthropology. Okay, we'll start. So medical anthropology is another subfield of anthropology, which will examine how the culture, how the social, how the biological, and the various environmental factors can influence the patient health, illness, and the medical practices. So this is what your anthropology will look after. That means it is examine how the different cultures, how the different social and biological, and the various environment factors will influence the people's health, their illness, and the medical practices. And this will explore how the people will perceive and respond to the various health related issues within their culture and the societal context. Okay, so that is what your anthropology will look after, like how the different culture or social or environmental factors influence the patient's health and medical practices. Now we'll see what are the scope of medical anthropology, where and all your medical anthropology has got a role. One is in the cultural interpretation of your health and illness. That is how the different cultures will define and will understand the health of a community, illness affecting them, and how the healing process can be done. So this is the first area where your anthropology has a role. So in the cultural interpretation of the health and illness, that is how the various cultures will define a illness or how they understand the health, illness, and the healing process. Second one is the traditional and the modern healing practices, like examining the false medicine, alternative therapies, and their integration with the biomedical practices. That is, if you have seen, there are different medical treatments available. Traditional techniques like people giving herbs are given, whereas in the modern treatment, they have goes to the hospital, they get the prescribed medicines. So this is the traditional and the modern practices. So your anthropology will look after what are the various traditional methods and what are the different modern healing practices and how these both can be integrated in the day-to-day biomedical practices. So this also has a role in the anthropology. Third one is the healthcare system and the various healthcare policies. That is, it will analyze the healthcare accessibility. As I told you, in every corner also there should be medical accessibility. Then equal quality of medical care should be given. And what is the effectiveness in the different societies? Like how much medical system has been effective in various societies, like in the rich side, in the poor people side, in the poverty areas, everywhere there should be a proper effectiveness of this healthcare system should be given. Then in the doctor patient relationship, as I told you, like how the doctor patient have a proper clear communication, how they build up a trust, how their different cultural beliefs will influence the healthcare delivery. So this also has been looked at by your anthropology. Then health disparities and social determinants of the health. As I told you, there will be studying of inequalities in the social, uh, studying of inequalities in the healthcare due to socioeconomic status, racial, and the cultural difference. So health disparities also been looked after by the your medical anthropology. Like there should not be any inequality in the healthcare providing. Everyone should be given equal treatment. Then epidemiology and disease pattern. Like your anthropology will investigate like how a disease has been spread, how the disease can be controlled, what is the cultural impact of that disease, everything being looked after by your medical anthropology. So it will investigate how a disease has been spread in the society, how to control that disease, what is the impact of that disease in a society. So all these things are looked after by the medical anthropology. Then biocultural perspectives on the health, like it will examine how the various genetic and the environmental factors will interact with the cultural health beliefs and behavior. That is, there are different genetic issues with different people, and there are different environmental factors like diet plans or humidity So many factors will lead to different health problems, and how that will interact between the cultural health beliefs. People have different cultural beliefs, like some will approach the hospital, some will not take the medical treatments. So how that will affect a people and healthcare system. Then medical ethics and global health issues. Like your medical anthropology will address the what are the upcoming ethical concerns or in the healthcare system, global medical challenges, what are things they have to face in the upcoming years. Everything will be looked after by the medical anthropology. So clear. So medical anthropology has a role in the understanding how different cultures will identify the health, illness, and healing, how the traditional method of healing and the modern method of healing will affect the day-to-day life, how an healthcare system should be managed, and what are the policies that they should have, how a doctor patient should have a proper relationship between themselves, then how health disparities can be clarified, like equality in the care should be given. Then what is the epidemiology and disease pattern? Like it will look after how a disease has been spread in the community, how that disease can be controlled, and what is the impact of the disease. Then it will also examine the biocultural perspectives, that is how the different genetical as well as environmental factors can affect the health, and how the cultural beliefs of the health and people's behavior will affect the healthcare system, and what are the various challenges they have to face in the globally. So this is what these are the areas where your medical anthropology has got a scope, or medical anthropology has got role. Okay, clear? Scope of medical anthropology is clear? Is it clear?
Okay.
Yes, it is clear.
Okay, next we are moving on to the what is the importance of this medical anthropology in the nursing healthcare? Why do you people require this medical anthropology? How it is important in the nursing and in the healthcare? So as I told you, medical anthropology will play a critical role in the healthcare. One is by enhancing the cultural competence. That is, this will help the nurses and other healthcare professions to understand what are the different cultural differences in the healthcare beliefs, in the healthcare practices, and in the patient's expectations. So, this will help nurses to understand how to approach your patients and how to have a proper treatment plan for your patients. Second thing, it will improve the patient providers communication. So it will create awareness of this cultural perspectives, which can lead to a better communication. So you can easily have a proper way of communication with the patients, and you can build up a trust among you and the patient, and then you can adhere to your proper treatment can be given to the patient. So this is another way in which it will help the nurses. So one is by it will help you to understand what are the different cultural beliefs a patient has, what are the different cultural practices they follow, and what are the patient's expectation based on their culture. Then second thing is it will help a nurse to have a proper communication with the patient party, so that it will help you in the treatment procedure also. The third thing is addressing the health disparities. That is, it will help you to identify what are the social and economical barriers to the healthcare access and work towards the solutions. Like you will understand why people are not approaching the healthcare system, because of what reason different people has not approaching the healthcare system, and then you can work towards the same, and you can find out the solutions, like how to give equality in the care for every people. Then supporting the holistic patient care, like you can encourage a comprehensive approach that can consider biological, social, and cultural influence on the health. That is, you can give a proper care to your patients, like you can provide a holistic patient care by encouraging the approaches of the patient treatment. Then you can inform the public health policies, like you can inform what are the guides, healthcare policies by considering the cultural factors in the disease prevention, health promotions. Like you can do campaigns, you can advise your patient what are the policies you provide in the hospital and how to promote this healthcare system. Like that, you can advocate your patients. You can advise your patient to have a proper healthy lifestyle and what are the different factors which can affect the disease patterns and how to prevent the same. Like that, you can teach your patients. Then integrating traditional and modern medicines, like you can advise the patients to occupy which treatment is good. Like maybe you can ask them to go for traditional or modern way of treatment, and then you can bridge the gap. Like some people will only trust in the traditional method of healing, so that barrier you can remove. You can help them to bridge a gap between the traditional healing practices and the new modern biomedical approaches. Like you can make them combine with the both the site of treatments. Then you can understand what is the global health challenges. You can assist in addressing the worldwide health issues, like such as the pandemics, malnutrition, and maternal health. You can advise the people like what are the pandemics they have to face, how to overcome the pandemics, how to prevent this malnutrition, and how to have a maternal health, what are the challenges they have to face. All this can be advocated by a nurse. So if they have a knowledge in the anthropology. So that is how it will help in the day-to-day nursing life. So one thing, you can provide a better treatment by understanding your patient. You can have a proper communication and you can build a trust among you and the patient. You can give a equality in the care. You can provide a holistic patient care by encouraging your patient. Then you can inform them about the public health policies and concerns. Then you can bridge them in the treatment, like traditional and modern treatment together. You can have a proper treatment patterns, and you can teach them what are the pandemics which can occur, how to prevent the same, how to overcome the malnutrition, what are the maternal health requirements. All this can be taught to your patients. So this is how medical anthropology will is important in the day-to-day nursing field. Is that clear? How the anthropology will help a nursing? Is that clear?
Yes, ma'am.
So therefore, medical anthropology will provide a valuable insight into the healthcare by examining the cultural, social behavior, and the biological factors. Therefore, it will enhance the effectiveness of your healthcare delivery. As I told you, you can understand your patient very well, and you can improve the effectiveness of your healthcare delivery, making it more patient-centered and culturally sensitive. And you can also integrate the medical anthropology into the nursing and healthcare, which will lead to improved patient outcome and equitable healthcare system. So that's how your medical anthropology will provide a proper healthcare system. Clear? Just read it once. Just read it once. I request everyone to read it once. Okay. Now we'll move on to the medical anthropologies and cross-cultural health studies. Okay. So what do you mean by cross-cultural health studies? So these are the studies which will examine how an health and illness will vary across the different cultural settings and help to design a more effective healthcare interventions. So that is what a cross-cultural health studies define as. So it's a study which will examine how health and illness will vary across the different cultural settings and how it will help to design a more effective healthcare interventions. So we'll see one by one. One is biocultural approach. That is, this is an approach which will integrate biological and cultural perspectives to understand the disease pattern and the health practices. For example, when you're studying lactose intolerance in different population based on the genetic adaptation and dietary habits. That is, some people have this lactose intolerance. Lactose intolerance means they can't consume any sort of milk or dairy products. Like if they consume any milk or any other dairy products, they'll start to vomit. So that condition we call as lactose intolerance. So when you are studying about how many people or how many population has got this lactose intolerance, you will study based on their genetic adaptation, like where they are living, what is their habit, like dietary habits, what are supplement, what are they intake in a day, what are the daily supplements they have, all those things you will look after, right? So that is what a biological approach is. That is, you just look after what is their habit, what is their genetic adaptation, which can cause the disease to occur. So that is what a cross-linked study will mean by. Okay, you are linking this condition with the patient's habits. Okay, so this is what a cross-linked study shows. Then the second one, if we see, is global health and cultural factors. For example, a medical anthropologist study how this globalizations impact the health and including like epidemiology of a disease, like what are the different cultural perceptions of HIV and AIDS. There are a lot of cultural perceptions regarding a HIV and AIDS. Like people think that a person who is having HIV or AIDS, people should not communicate with them, people should not sit with them. So there are different cultural perceptions. Then traditional versus modern medicines. That is, as I told you, traditional medicines like herbal remedies were used in the ancient time, and now you have different pharmaceutical medicines available in the markets. So there is a fight between the traditional, which is good, traditional or which modern medicine, which is good, which is useful. So these are cross-link studies people do. So this is what cross-link studies exactly mean. Like you will connect two different points and make that understand. Understood what is cross-link studies? Understood the cross-link studies? Now we'll move on to the what are the different fundamental concepts in this sociology and the anthropology. Okay. Now we'll see what are the different fundamental concepts. Okay. Can you please mute? Can you please mute? I request please mute yourself. Can you please mute yourself? So moving on to the next topic, the different fundamental concepts in a sociology and in the anthropology. First, we'll see what are the fundamental concepts in sociology one by one. Okay. So the very first fundamental concept in sociology is the society, like a structured community of people bounded by different traditions, law, and institutions. So this is the very first concept in a sociology. Like what is a society? So society means the people, where different people bounded by different traditions, different laws, and different institutions. Second fundamental concept which come in under the sociology is the social institutions, like organized structures, family, education, religions that will govern the social behavior of a person. Second one is, so third one is the socialization, like a lifelong process of learning cultural standards, values, behavior. All these will come under the concepts of sociology. Then cultural. There are different beliefs, there are different values, there are different customs followed by different people. There are different practices which will shape the societal interactions. Then social stratification. Stratification means there are different hierarchical rankings of individuals, like based on the wealth, power, and prestige. For example, if you see a society, there are people who are middle class, higher class, lower class, like that different ranking you people will give, right? So that is also based on the patient, that is based on the wealth, power, and prestige. And if you see that caste, there are higher caste people, lower caste people, untouchable people, like that. There are different stratifications are given based on the power and prestige they have. The sixth one is devices and social control. That is the study of behaviors that can violate the different social standards and the mechanisms which are used to enforce the conformity. Then the social changes like transformation in the societal structures due to various technologies, various movements, and various policies. There are different changes happening. So all these things are the various fundamental concepts which comes under the sociology. So if in exam, if the question comes like list out the various fundamental concepts, we can just list out them one by one. So the various fundamental concepts which comes under the sociologists, one is society, one is the social institutions, one is the different socialization, cultural beliefs, then social stratification of different hierarchy, demands and social control, and social changes like transformation due to the various advancements in the technology, policies, and movement. So these things you can list out if the question comes to mention the fundamental concepts in sociology. Next, what are the various fundamental concepts in the anthropology? So anthropology, if you see, the very first one is the culture. Culture means there are different learned behaviors, there are different beliefs, and there are different traditions which are shared by a group of people. Then kinship and family, like social structures which can define the relationship, inheritance, and a family roles. This also comes under the anthropology. Then language and communication, like the role of linguistic development in the cultural expression and the identity, like how the people communicate, how the language barrier and everything occurs. Then subsistence pattern, like how a society sustain themselves. Like there are people who are living in the forest region, they live by hunting as their earning. Then there are people who are almost middle class who has a farming as their earning. Then there are people who are working in the urban areas, works in the industrial as and they work in the industrial setup and they earn. So that is what subsistence pattern. Like different societies, how they sustain themselves by hunting, by farming, or by working in a industrial economies. So all this comes under the anthropologies. Next is rituals and the beliefs. Like different religions has different spiritual beliefs and spiritual systems which will shape the cultural worldwide. Then human evolution and adaptation, like the various biological and behavioral changes that have shaped the human development over the time. So these are the different fundamental concepts which can come under the anthropology. So list out one by one. One is the culture, that is different beliefs, different traditions which will shape the community. Then kinship and family, that is social structures that can define relationship, inheritance, and the family roles. Then language and communication, like the role of linguistic development, like different people has different sort of language worldwide. Then subsistence patterns, like different people how a community survive themselves by hunting, farming, or by any working in the industrial aspects. Then different rituals and different beliefs of different communities, which will also shape the cultures worldwide. Then human evolution and adaptation, like the various biological or behavioral changes, which can also shape the human development over the time. So these are the various fundamental concepts which will come under the anthropology and under the sociology. Is this clear fundamental concepts? Please read it once. I request everyone to read the slide once. I request everyone to read the slide once. Please read it. Please read the points. Just read the fundamental concepts. Just read the fundamental concepts. Okay, once it is done, now we'll move on to the next topic. Social determinants of health. Okay. We'll see what are the different social determinants of the health. Can we go forward? Am I audible? Are you there in the class? Are you there in the class?
Yes, we are there.
Okay. So next, we are moving on to the next topic. That is, what are the different social determinants of our health? Okay. So, social determinants of a health refers to the non-medical factors that can influence the health outcome. This can include economic stability, education in a society, social and community context, healthcare accesses, and the environment. So these are the various factors which can determine the social health. So which are the various factors? One is economical stability of the society. Then how much the society is educated. Then what is the social and community context. Then healthcare accesses and the environment. Then addressing these determinants, this is essential for improving the health equity and reducing the disparities. Okay. Now we'll see one by one in detail. Like what is the impact of your socio-economic status on the health? Now we are going to see all these topics one by one. Okay. So for the first one, how does the socio-economic status has an impact on the health? So higher income and a better health, that is individuals with the higher socio-economic status have a great access to the healthcare system and a better living conditions and a longer life expectancy. Correct? Like people who is in a very high income state, like people who are very rich, will always have a so very good socioeconomic status, and they will get more access to the healthcare system because they are rich. They can get access to the healthcare system and they are in a better living conditions. Therefore they get a better treatment. They have a longer life expectancy. Whereas those who are poor, poverty and health disorders, like those people who have a lower socioeconomic status, they are linked to the rates of chronic illness because they don't have that much access to the healthcare system because of the poverty. So they will lead to chronic illness, malnutrition, and limited healthcare access. Understood? So this is how socio-economic status has a role or impact on the health. Those who are rich enough will have higher economic status and greater access to the healthcare system and greater life expectancy. Whereas those who are poor or those who are living in the poverty, they will consider as a lower socio-economic status and they are more prone to the chronic illness, malnutrition, and they have very limited access to the healthcare system. Then healthcare accessibility. As I told you, affordability of medical services will influence the overall health and outcomes and the disease prevention. Those who have the access to the medical services, they will be treated well. The others will not be treated. So there will be again people having a less health outcomes will be happening, and there will be disease prevention also. If everyone gets equal treatment, then there is a disease prevention. If people who are only rich gets the proper treatment, then there won't be any proper equality in the care. So this is how the socioeconomic status has an impact on the health. Is this clear how the socioeconomic status affect the health? Is this clear? Is it clear?
Yes, mom, it's clear. It's clear.
Okay. Okay, fine. Next is how the education and employment will influence the health. Okay, this is the second topic which we are going to see, like how an education and employment will help to improve the health. So higher education and health awareness, like educated individuals will make a informed health decisions and they will adopt to a healthy lifestyle, isn't it? So people who are having education, they know what is the requirement to take the health decision, if they have to undergo a treatment or not, like that kind of decision they will be able to take, and they will adopt to a better lifestyle. Then employment and healthcare access. Like if a person has a stable jobs, they will provide a better healthcare benefits and they will have a financial securities and which will overall improve the well-being of their. Then job conditions like occupational hazards. The people who are exposed to the high risk works can affect their physical and mental health. Like the people who are working in the coal mines or in the glass factories, they are always exposed to the harmful chemicals, gases. So they have high risk of getting health issues. So that is one thing affecting the healthcare system. Whereas when the person is employed, they will have a stable jobs. So they have a financial stability also because they are employed, they are earning something, so they have a better healthcare benefits also they will get. So they can overall improve their behavior. Then people who are having education, they know what is good for them. They can opt for a better lifestyle and they can have a better decisions in their health. So that is how an education and employment will affect the health. Is this clear? Is it clear?
Yes, madam.
Okay, fine. Next
Yes,
is
it
what
is.
is the okay. Next, what is the role of a family in a health? How a family will affect the health. So first one is the emotional and the psychological support. So obviously, family will provide care and encouragement that will contribute to the mental well-being of an individual, right? So healthcare decision making, families has got different beliefs and different cultures. So family beliefs and values will influence their medical choices and treatment advice. Like people who believe in their cultures, some believe in their culture and they prefer not to get any medical treatment. Some those who are good enough, they decide to get the medical treatment from the hospital. So that's how they take up their decisions. Then generational health influences, like familial history and genetics also plays a role in the hereditary diseases and health behaviors. Like those who are having insulin resistance, like diabetes, it's a one of a familial history, right? If the father has, that will be inherited to the kids also. So family history and genetics also plays a role in the hereditary diseases. So that is how your family has a role in the healthcare setup. Clear? One thing, the families will provide a care and encouragement which contributes to the mental well-being of the individual. Second thing, the family helps in making up a decision in the medical treatment. Third thing, familial history or genetical history also has a role in the health. So that is how the family has a role in the health. Is this clear? Just read it once. I request everyone to read it once. Just read the slide once.
Yeah.
Done. We'll move on.
Sorry, mom.
Okay. Next one is gender and the health. Okay.
Okay.
So how that will affect the health. So healthcare accesses and gender roles. Women and men will experience different health risks based on the biological and the social factors like reproductive health and gender disparities. That is, access to the maternal health, contraceptions, and diseases prevention varies globally, right? Different areas, they have different accessibility and prevention varies according to the places. So, mental health and gender, if you see, mental health issues can manifest differently across the genders. For example, women may report higher level of anxiety and depression, whereas men might have a high rate of substance abuse. So that is how the gender inequality also can occur in the case of healthcare. Like women will not have a proper healthcare accessibility because of them being in the house. People say that no need of getting any treatment, whereas men who is going outside, they prefer more getting of medical treatment. Like that, inequality can occur in the gender also. So that is how the gender affects the healthcare system. Is that clear? How the gender will affect the healthcare system? Just read it once and see. Just read it once and see.
Mama, I can't get you.
I request you to read and see this topic. Just read the slide like how the gender affect the health. That is, usually, according to the places, there are different hospitals and accessibilities are there. So, how the gender affect is there actually is in a study, you can see the women will have a high level of anxiety and depression. Okay, while men will have a high rate of substance abuse, like men will be having abuse like alcohol, all kind of abuses, and their rate of death is more when you compare it to the women. And women has got a lot of restrictions, like they tend to live inside the houses and they get less chance to go to the hospitals, whereas male who is working outside, they have more access to the healthcare system. So that is how there is an inequality between the genders occurs in the health. Clear? Is that clear?
Yes.
Okay. So next one is how the environmental factors can affect the health. Okay. So this is the next topic. So first one is the living conditions and the health risk, like poor housing, pollution, unsafe water contribute to diseases and infections. So that is how the living conditions can cause health issues and health related problems. Those who are living in a poor housings like shed and all, then who are living in a polluted regions, those who are using unsafe waters, everything can cause what infections. Then climate changes and health, like environmental changes can also affect the disease pattern. Food security and the natural disasters, everything can also lead to health issues. Then workplace and community environment. If the workplace is not that safe, community resources, and can also promote to healthier lifestyle. Like those who are working in the factories, they are more exposed to the dangerous gases. So they are more can be a chance of coming as a patient. Whereas those who are working in a safe workplace, like college, like that people, like lecturers, those people has a safe workplace. So those people can promote the healthier lifestyle and the well-being. So that is how the conditions can affect the health of a community. Is that clear? Is this
Yes,
clear?
ma'am, it's clear.
Okay. Next is how your healthcare system is being structured. We'll see how your healthcare system is structured in a society. So if you see, there are different types of healthcare systems are there. Like there is public health, private healthcare, and traditional healthcare. So this is how the healthcare system is being classified. So public healthcare system means the government will be funding and this it is accessible to all the citizens. So it's a public. So this healthcare system is being funded by the government and it is accessible to all the citizens. Second one is private healthcare. So private healthcare means it is privately funded by some of the hospitals or some clinics or by some people. And this will always provide specialized services. It is not accessible to the entire population. It is just providing some special services, and this is funded privately. Last one is traditional healthcare. They are indigenous and they are an alternative medicine based on the cultural practices like familial beliefs and all. Those who are having rituals, beliefs, they go for this traditional healthcare like Ayurvedic, herbal, those kind of things will come under the traditional healthcare. So this is how a normal healthcare system is classified in a society: public, private, and a traditional healthcare. Is it clear?
Yes, ma'am, following.
Okay. Next is role of health in the institution. Like institutions like a hospital, clinics, and some research centers will also play a critical role in the diagnosis of a condition, treatment of the condition, and the prevention. Then the medical professionals and the other social roles like doctors, nurses, and the other allied healthcare professionals also contributes to the patient care as well as improving in the public health. Clear? This is how the different institution and medical professions contribute to the public health. Now we'll see the access to the health services and what are the different barriers people has to the healthcare system. Okay?
Okay.
Yeah. First one is the geographical barriers. That is, those people who are living in the rural populations often will have a limited access to the healthcare facilities. So this is one of the geographical barriers people have. Whereas people who are living in the urban areas will have more access to the healthcare system. Second barrier is your economic barrier. That is high medical cost. If you go to a private hospitals, obviously you have to pay high fees. So high medical cost and lack of insurance. If you see, all the hospitals will not accept the insurance. So in such conditions, that is also causes economic barrier. Like people who can't afford this cost and the people who doesn't have insurance, they won't go for medical treatment. So that is another economical barrier people will face. Okay. Next is the cultural barrier. Cultural barrier in the sense language difference. People who are living in different countries, when they don't know their local language, again it's a barrier. Like they can't effectively communicate with the doctors or the nurses. Then stigma attached to the different conditions like AIDS people, we just avoid those people. So that kind of stigmas, then distrust, like when you don't trust a medical institution, all these things can cause a cultural barrier. Some people don't trust a medical institution, so they don't go for the treatment. Those people who are having stigma, like they don't want to go, they don't want to touch that person, and those who are having different language barriers, that is all contribute to the cultural barriers, which can cause less accessibility to the medical. Then next one is the government policies, like regulations and the funding impact the availability and the affordability of the services. Like if the government funds, then there will be affordability for the services. If there is no government funding, there is no government schemes and all, then people has to pay for the same. So again, people will be coming for the treatment. So these are the different barriers which the people has to face when they come for the medical services. One is geographical barrier, one is economical barrier, cultural barrier, and government policies. Understood the various barriers? Clear with the various barriers? Is it clear?
Yes, it is clear.
Okay, next we'll see how the patient behavior and complaints will affect the healthcare system. Okay. there are different factors which can influence the complaints. Like, as I told you, when the patient is educated, they can take up the decision for their health. When the healthcare provider has a better communication, so that healthcare provider can easily communicate with the patient and can build up a trust and can provide the proper treatment. And the cultural beliefs also will affect the adherence to the treatment. So this is a one factor which can influence the complaints. Next one, non-adherence risk. Like medications, non-complaints, and avoidance of medical advices can lead to poor health outcomes. Like some people will not be trusting the medical professions and they don't accept the medical treatments or medical advices. Some people, like if a nurse advise a patient to take this medication for 1 month, and if they don't listen to that medical advice, then it can lead to poor health outcomes. Then strategies for improving complaints, like health literacy programs should be started. Like the nurses should teach them what are the various health literacies, and you should teach them what is the importance. So like that you can improve the health literacy programs. Then community outreach, like the nurses or the healthcare professions should go to different communities and you should speak to them in their local language and you should teach them what is the importance of getting medical treatment at the correct time. Then there should be always a patient-centered care and enhanced adherence. Like we should keep a proper hostility care to the patient. We should not consider any other factors like their economic status, whether they are rich, whether they are black in color, fair in color, no matter whatever it is, we should give a proper patient-centered care. So that is how we can improve the patient's behavior towards the hospital sites. Is that clear?
Yes, ma'am.
Okay. Now, the cultural differences in the healthcare beliefs and behaviors. How people with the different cultures has different behaviors and beliefs in the health. That is cultural perceptions of illness. Like some cultures will attribute diseases to supernatural causes, while some others will emphasize it into medical explanation. Like some people believe that is because of the supernatural power he or she is behaving like this, and some believe that is because of the normal medical condition and comes for the medical treatment. So that is what cultural perception of illness is. Then traditional healing practices. Like there are people who believe in the Ayurvedic treatments like herbal medicines, acupuncture, spiritual healing. Like they go to some temples or church, mosque for their treatment, healing. Like that, traditional healing practices are there. Like those who believe in their cultures. Then health-related behaviors. Some people believe that if they take a proper diet, do proper exercise, proper hygiene, and all can have a preventive care differ based on the cultural forms. They believe that there is no requirement of medical treatment. If they have a healthy lifestyle, they can have a proper health. Then bridging culture gaps, like culture sensitive behaviors will improve the trust and effectiveness in the in treatment. So being a medical profession, you should bridge the cultural gaps. You should teach them what is the requirement of the healthcare system and you should make them trust in the healthcare system and you should show them effective treatment. So these are the various cultural difference and perceptions people will have. So some will believe in the supernatural powers and some believes in the hospital treatment and they come across the treatments. Some believes in the traditional method of healing, some will approach the pharmaceutical aspects for healing. So this is how the cultural beliefs will affect the health. Is this clear? Is this
Yes,
clear?
ma'am, it's clear. Yes.
Now, cultural perspectives on the health and healing. That is, each culture has got a distinct perspectives on the health and illness, and often it is rooted in the historical, social, and environmental context. Some key aspects include perception of health and illness. Like some culture view illness as a natural imbalance, while others see it as a result of supernatural forces of spiritual disharmony. As I told you, some believe it is because of the natural issues only they are getting the sickness. Some believe it is because of the supernatural power or forces that illness is coming. Then dietary practices, like specific diets and food restrictions are believed to prevent or cure illness. As I told you, there are different beliefs in the diet plans as well. So some people believe that if they take care of their diet, like if they properly look after their diet, meal plans, they can cure their illness. No need for any medical treatment. So this is another cultural beliefs people have. Then family and communities role, like any decision making about a health is often influenced by the family elders. Like when you come for a treatment in the hospital, then when you are asked to sign the hospital papers, you'll always ask for your family's opinion, right? So obviously that is influenced by the family elder persons and their traditional healers and the community's concepts. So they will ask their elders and then they take up the decisions in the treatment. Then use of herbal remedies. As I told you, many cultures will rely on the medicinal plants, herbal Ayurvedic therapies instead of going for the pharmaceutical or hospital treatments. This is how the cultural beliefs and practices affect the healthcare system. Is this clear?
Yes, ma'am.
Now, traditional and the alternative healing system. As I told you, there is traditional healing system like Ayurvedic systems. In India, if you see, it is based on the balancing of body's three dohas like Vata, Pitta, Kapha. It is the Ayurvedic terms. Like through diet, through herbal medicines, through doing yoga and lifestyle changes, a person can be healed. This is one of the traditional method of healing. Like they believe that if they properly maintain a diet, if they take up the herbal medical plans, and if they do a proper yoga, their life can be changed. So this is how the traditional people look for the healing system. Okay. Now, in the alternative, there are different complementary medicines available. That is, there is homeopathy, neuropathy, and cerebropathy. That is, homeopathy means uses highly diluted natural substances to trigger the body's healing responses, or naturopathy, like which will focus on the natural healing through your diet, lifestyle, and herbal remedies, and chiropractic care, like it aligns to the spine and musculoskeletal system to promote the healing, like doing exercises to get the proper relief from the sickness. So these are the other alternative methods people rely on. Okay, is that clear?
Yes, ma'am.
Okay, just
Following.
read it. Okay, just read it once. Then next, how as the religions and spirituality has an impact on the health. Now we'll see what is the impact of religion and spirituality on a health. So as I told you, the religious belief and spirituality also plays a significant role in the shaping of healthcare behaviors and health healing processes or practices. Like some are believing in their faith. There is faith-based healings are there. Like many cultures will believe in the divine interventions, like miracles, or through their prayers, they can get the healings. For example, faith in healing in Christianity or spiritual cleansing in the African traditions. So there are faith-based healings are there. Some people refuse to go to the hospital. They think that if they sit and pray to the God, they get the healing. This is how the religious belief and spirituality play a significant role in healing. Is that clear? Faith-based healing? Is it clear?
Well understood. Very
Yeah.
clear.
Yeah. Next is religious fasting and dietary restrictions. Some believe that if they not only pray, if they take fasting for their God, they get the release from the sickness. Like many religions has dietary rules believed to be contribute to the physical and spirituality well-being. Like examples, fasting in the Islam, Christianity, like vegetarianism in the Hinduism. All this can lead them to have a proper health. This is what the different beliefs they follow. Okay.
Okay,
Next is
ma'am.
next is mental and the emotional well-being. Like prayer, medication, and spiritual rituals are linked to lower the stress and better mental health and faster recovery from the illness. Then end of the life care beliefs. Like different faiths have distinct beliefs about the health after death, afterlife, and rituals for the dying, which has an impact in the palliative care and medical decisions. So that is how a cultural beliefs and affect the has got an impact on the healthcare system. Clear? Now we'll
Clear.
see. Yeah, now we'll see what are the different global health issues and the challenges they have to face. So global health will focus on improving the health and achieving equity in the healthcare access worldwide and various challenges which can affect the population differently based on the economic, social, and political factors. So we'll see one by one. So health disparities between the nations. That is, health disparities refers to differences in the healthcare access, healthcare quality, and healthcare outcomes between the different countries. Suppose if we say a developed country has a better healthcare accessibility, better quality of healthcare can be given, and better healthcare outcomes can be seen when compared to a non-developed country. Okay, so particularly between a high income and low income nations. The very first thing, if you see, with the factors contributing to the health disparities, one is the economic inequality. As I told you, low income countries will have limited healthcare systems or limited healthcare infrastructures and medical resources. So those countries will have very low health outcomes also. So that can be a cause for health disparities. Those people living in the low income countries will have less healthcare infrastructure and less medical resources available for their medical treatment. Then access to the healthcare. Many countries lack the basic healthcare services and trained professionals and the health essential medicines. That's why they send the people to another hospitals and all, because of that they lack the accessibility, because they don't have proper services, they don't have the healthcare professionals working for them. So and they will lack the essential medicines also. Then malnutrition and food insecurity. Like developing nations always suffer from the undernutrition, while a developed nation will have faced the obesity. Because in a developed country, people tend to get everything and they eat everything and they become obese. Whereas in a developing nation, there is lack of things. So people will get undernutrition. So that is how malnutrition and food insecurity affect the healthcare system. Next is the environmental factors, like people who are living in a poor sanitation area, those are drinking unsafe water, those are living in the polluted areas can lead to disease burdens and can affect their healthcare system. Then education and health literacy, like a lack of awareness about the disease prevention and treatment can also worsen the health outcomes also. Like educated people who are misusing the resources can also lead to worsen health outcomes. So this is how different disparities occurs between the nations. Clear how different issues can occur between a high and a poor countries. Is that clear?
Yes, ma'am.
Yeah. Next is, what are the impact of a globalization on our health? So globalization has significantly shaped the health trends both positively and negatively. So if you see what are the positive impacts of globalization, one is medical advancement. With the globalization, there is advancement have come across the medicals, like faster spread of medical knowledge, requirement of vaccines across the nations, and various treatment options available. Like that, it has got a positive impact. Then international collaborations, like different countries will work together to fight against the diseases and to improve the overall healthcare system. Like that, the globalization has got a positive impact in the healthcare system. Clear the positive impact? Positive impact is clear. If you see the
Yes.
negative, yeah, if you see the negative impact of globalization, then there is a high spread of infective diseases. Like because of increased global travels, like people coming from different countries, it has led to rapid transmission of diseases. For example, the COVID-19, Ebola virus, because of the people coming from the various countries, this disease has been spread. So that is one of the negative impact. Second thing is westernization of diet and lifestyle. Like there is increased consumption of processed food and sedentary lifestyles, which can lead to raising cases of obesity, diabetes, and heart diseases because people tend to occupy that Western culture. They like to have the processed food, fast food. Because of this, people become obese, diabetic, and other health conditions and all it can affect. So these are the some of the negative impact of the globalization which affected the people's health. Is this clear? Just read it once.
Yes, ma'am, I'm following.
Yeah, just read the slide once. Next, what are the emerging diseases and epidemics? You can see. Okay. So new infections and diseases and epidemics will cause a major public challenges. So one thing you see is a factors which can lead to emerging diseases like climate changes. A warmer temperature can lead to a spread of vector-borne diseases like malaria, dengue can affect. Then antimicrobial resistance, like overuse of antibiotics can lead to drug-resistant infections like MRSA, methicillin-resistant staphylococcus bacteria, and multi-drug resistant tuberculosis. Like people who use overusage of drugs, the people who consume a lot of antibiotic, they become resistant to the infections. So they won't be any more effective to the antibiotics. So this is one another cause for emerging diseases. Then the climate changes, like people who are living in a warm temperature can lead to some other vector-borne diseases which can affect the community itself. So these are the some of the emerging diseases and challenges. Okay. Then the notable epidemics and emerging diseases. Another's are COVID-19, which was there in the 2019 till the present, like global pandemics which can affect millions of people, which can highlight the weakness in the healthcare system. Like when the COVID-19 was spread in the country, there were high requirement for the healthcare system. And that time you have seen very weakness, like everyone cannot be accommodated. So there are different problems arised in the healthcare system. Then during the Ebola outbreak in the year 2014-16 and in the 2021, there was high fatal diseases primarily affecting the African nations. Then when there was a breakout of Zika virus in the year 2015 to 16, like which is a mosquito-borne disease which caused birth defects in the people. So these were the some of the notable epidemic and emerging diseases which had come across the countries. Is that clear?
Yes, ma'am.
Okay. Now we'll see what are the role of an international health organization. As you know, there are various healthcare organizations are there, right? Can you name any of the healthcare organizations? Do you have any idea about which are the different healthcare organizations are there in our country? Can anyone name at least one?
We have the World Health Organization.
Yeah, very good. Well, World Health Organization, WHO. Very good. Now we'll see what are the role of this international health organizations. Okay. So there are several organizations which can work to address the global health challenges. So first one, if you see, it's a key organization and their roles. For example, WHO, World Health Organization. They coordinate the global health responses, disease surveillance, like they will take the surveillance and they conduct various vaccination programs to educate the people the need of taking vaccinations. Then another body is the United Nations or UNICEF, which will focus on the maternal child health, nutrition, and the clean water access. Then another organization is the World Bank and IMF, which will provide financial supports for the health infrastructures in developing nations. Then the other board is Doctor Without Borders, MSF, which will provide deliver medical aids in the conflict zones and in the disaster area. Like wherever there is a disaster occurred, like disaster calamities or anything occurs, in such area is being funded by the Doctors Without the Borders, MSF. Then the overall financial support and health for the health infrastructure is provided by the World Bank and the IMF. Then WHO will take the surveillance and conduct the vaccination programs for the prevention of the diseases. And UNICEF or UN, they focus on the maternal health, childbirth, nutrition, and the use of clean water access. So that is how different organization works. Okay, clear? Role of international organizations in the health. Just read it once. Yeah, just read it once. Next is, what are the impact of these international health organizations? Okay, so what, as I told you, they conduct the various surveillance, they conduct various vaccination programs, focus on various health, nutrition, and everything. What is their overall impact? One, it helps in the eradication of the diseases. That is, the WHO will lead campaigns which will help the eliminate the smallpox and significantly to reduce the polio cases. Then they start up the global vaccination programs. So this will initiate like a Gavi, Vaccine Alliance, will increase immunization. Like people will get immunized against that diseases. So increase the immunization coverage in a low income country, like people who are in a country where there is a developing country or low income people who are getting less access to the hospitals, when they take up this vaccination, they become immunized to that diseases. So it will cover up the in the low income countries. Then emergency responses like quick interventions in the health crisis, such as in the Ebola or COVID-19 conditions, to give emergency responses and all, these healthcare organizations are important. Understood what are the impact of the various international health organization? It helps in the eradication of disease. It helps in the global vaccination program, which can increase the immunization coverage in the low income countries and helps in the emergency responses where quick intervention in the health crisis are required. This much is clear?
Yes, ma'am. That means the impact of international health organizations are just positive impacts.
Okay. Now we'll see what is a nurse role in this socio-cultural context. Okay. So a nurse will play a vital role in the delivering culturally competent healthcare worldwide. One is culturally sensitive care. Like you are the one who will be understanding your patient's different cultural beliefs about the health, illness, and treatment. And then you should adapt to their communication style to meet the diverse linguistic and the social needs. So you play, nurses play a vital role in the delivering of the healthcare system. So you should have a proper communication and you should properly understand your patient. What is your patient's cultural beliefs about the health, treatment, illness, and everything you should understand first. Then you should adapt a communication style also. Like if they don't understand your language, you should try to communicate in their own language and you should meet the diverse linguistics and social needs also. Second thing is public health advocacy. Like you are the one who should promote the health education on hygiene, on taking vaccination on the right time, to have a nutrition in unserved communities. So you should educate your patient. You should ask them to have a proper hygiene, proper vaccination on time, and have a nutrition in the unreserved communities. And you should also address the social determinants of health, such as poverty, education, gender equality. Everything should be addressed by a nurse. Like poor people, they should get medical access. Education people, they should not. They should have a better lifestyle, and gender equality also should be eradicated. Like equal treatment should be given for both male and for the females also. Next is disaster and humanitarianism in nursing, like providing emergency medical care in the disaster-stricken and war-affected regions. There also you should give a proper treatment, like wherever there is a disaster or wherever there is any war-affected regions are there also you should provide a better treatment. For example, nurses playing a critical role in managing COVID-19 and Ebola outbreaks. So these are the conditions where there is an emergency treatment is required, and you should give a proper treatment for the patients. Next one is the leadership in a global health policy. Like nurses should contribute to the